to battle with the effects of the COVID-19 pandemic as a nation, the ministry continues to work towards ensuring that healthcare is accessible to all. The Health Ministry has recorded significant growth for the year 2022, especially in areas of infrastructure, skill development for healthcare professionals, and service advancement. We were able to catch up with the Minister of Health, Honorable Dr. Frank Anthony, during a sit-down this week. During the interview, he highlighted some of the major achievements for this year.
With the initiative of the government of Guyana to upgrade health facilities countrywide, there has been a series of infrastructure developments and improvements of healthcare facilities across the region. The public health sector consists of 420 facilities, which include health centers, health posts, district hospitals, and regional hospitals. During the course of this year, close to $1 billion was expended to upgrade existing infrastructure to improve the service experience for patients visiting health facilities. A total of 6 regional hospitals were upgraded with the new technology of digital X-ray equipment to boost X-ray service at those facilities. Operating theaters were also upgraded at Aishalton, Moruca, and Mabaruma to benefit patients within those areas and neighboring communities. With these enhancements, patients will be able to undergo surgeries and access other major health services at their regional health facilities.
This year, one of the things that we did was to look at all the health posts and health centers around the country and made that kind of assessment. What would we need to do to improve the infrastructure that we have there, waiting areas, toilet facilities, expanding maybe rooms where the doctors or nurses can consult the patient, that sort of thing. And so this year we spent close to $1 billion upgrading a lot of facilities around the country. So on average, every region received $100 million from the ministry to upgrade health centers within their regions. So we have upgraded these infrastructure, and I think the feedback that we've received from people is that, they feel more satisfied with the new developments or the new things that they've experienced when they go to the health centers. So we took a decision about a year ago that any future X-ray that we're buying in the public sector, it would be digital. Previously, we used to buy a combination of analog X-rays, which are really outdated because you have to use films. And with digital X-rays, you get the image, you can send that to a smartphone so people can see that in real time. And it's much easier to move around on the internet for interpretation.
Yo, it's a new year. What y'all doing?
I'm getting my booster shot this year.
I'm getting my booster shot this year.
I'll be getting my booster shot this year.
I'm getting my booster shot this year.
I'm getting my booster shot this year.
So what y'all waiting for?
Do I need a COVID-19 vaccine booster?
Yes. The protection COVID-19 vaccines provide decreases over time, especially for certain groups of people. Recent research suggests their effectiveness at preventing infection or severe illness wanes over time, especially in people ages 65 years and older. The emergence of the variants further emphasizes the importance of vaccination, boosters, and prevention efforts needed to protect against COVID-19. The Center for Disease Control and the Ministry of Health recommends everyone ages 12 and older get a booster for the best protection against COVID-19.
A message from the Ministry of Health and the CDC.
Another notable project is the Smart Hospital initiative undertaken by the ministry through support from the United Kingdom and the Pan American Health Organization. The Smart upgrade is geared at improving hospital resilience, strengthening structural and operational aspects through greener technologies. 4 facilities have so far undergone upgrades and were declared open by His Excellency Dr. Mohammed Irfan Ali, President of the Cooperative Republic of Guyana. Those are the Mabaruma Regional Hospital in Region 1, the Diamond Diagnostic Center in Region 4, the Lethem Hospital in Region 9, and the Lenora Cottage Hospital in Region 3. In addition to these expansions, maternal waiting homes were developed at various facilities in the hinterland areas to extend better care to pregnant mothers while they are awaiting childbirth.
I think one of the programs that have made a lot of impact is developing waiting homes. Now, what is a waiting home? A waiting home is a building that we set up in the hospital compound. So pregnant women, rather than waiting until they go into labor in their village and then try to get to the hospital, we are able to bring them out before. They stay in this facility that we have. When they go into labor, they're right on the compound. So we move them across, we deliver the baby, and then they go back, they wait a little bit once they feel well, and then they go back to their villages. In that way, we are able to provide better care for pregnant women. So we have created a network of waiting homes across the hinterland, and we feel strongly that this is going to help with safer delivery.
The ministry provided training opportunities for healthcare workers with the primary aim to strengthen the health sector in Guyana. Recently, 200 community health workers were successfully trained in Region 1, Barima-Waini, Region 8, Potaro Siparuni, Region 9, Upper Takatu, Upper Essequibo, and soon to be Region 7, Cayuni Mazuruni. These community workers will be deployed to health centers and health posts within those regions. In December, the ministry was able to launch a telemedicine app at the Guns, Napi, Yupikari, and Parikwanao village in Region 9. With the intervention, the trained community workers will be able to utilize technology and speak to an expert at Georgetown Public Hospital for cases where assistance is needed.
So every health center right now in Regions 1, 9, 8, and soon to be 7 as well, would have at every health post or health center at least 2 community health workers. So we have been trying to train people and employ them so that they can provide some level of service. Now, community health workers, we want to improve the level of care that we can offer at the village level. And so we've been experimenting with technology. And that is why we have started using telemedicine in 4 pilot sites. And we have tested this at Guns, which is very remote, and we see how that is working. And we have the other 3 sites, Napi and Yupikari and Parikwanao. These are the other 3 sites. And so if the community health worker is not sure, they can always dial up the doctor at the Georgetown Hospital and get professional advice on what to do with each of the cases. And this telemedicine system that we're developing will extend that in the future. So in a way, it is helping us to overcome some of the challenges that we have with human resources.
To combat the challenges for persons having to relocate who are desirous of pursuing a career in nursing and other related fields, the Ministry of Health was able to decentralize some of its nursing programs within the regions. The Nursing Assistant Program was launched in Regions 1, Barima-Waini, Region 2, Pomeroon Supernam, and Region 9, Upper Takatu, Upper Essequibo.
What we have also done for nursing assistants is decentralize the training. So we have done training in Regions 1, Regions 9, and just a couple of days ago we've started the one in Regions 2, and we are going to do it for every region. So we are going to get a larger pool of nursing assistants, and as soon as they graduate, they'll be employed by the ministry. So right now, it takes about 18 months for them to complete their program, but we have to start teaching. prior to this, what was happening is that everybody had to come to Georgetown to be trained, and our capacity in Georgetown was quite limited. We weren't training more than 50 people per year. So that was not going to meet the needs that we have in the respective regions. So by decentralizing, putting faculty out there, working with the standardized curriculum, we'll be able to address this.
The ministry is expected to launch hybrid learning technology for the registered nurses program in early 2023. This program will see approximately 1,000 people being trained every year after the first batch completes their 3-year period.
Now, for nurses, registered nurses, our traditional approach would have been that people apply to do nursing. Once they meet the criteria, we bring them in and we distribute them to the 3 schools that we have in the public sector, either Georgetown Hospital, New Amsterdam, or at Linden. But these schools combined, we have 250 spaces. And this is a 3-year program. So it is extremely difficult to scale up with the way that we've been training. We need more nurses, and especially with the expansion that we'll be having with the hospitals that we're building. So one of the things that we have done this year is we have worked with several partners to take the existing curriculum and develop a hybrid program. So in January next year, we are going to launch this new registered nursing program. And we are hoping to recruit at least 1,000 persons who will be interested in nursing. So you basically go online. There will be a welcoming page. You register yourself. We check to make sure that you meet the requirements. And then you will have different modules that will open up. Once you complete the module, you'll have to do the practical component of it. And during the year, next year, we'll be developing several simulation centers. So where the persons who have completed their theory would now be able to come in and do their practical components. And over the 3-year period, we hope that the batch that we're taking in early next year, they will complete. So at least we'll have 1,000 nurses down the road. And every year from now on, we'll try to take in at least 1,000 nurses.
With the implementation of the Advanced Suicide Prevention Act and the Mental Health Act, the Ministry of Health will soon be providing training for primary healthcare physicians to enhance their ability to detect signs of depression and anxiety when patients visit the health centers, health posts, or hospitals.
One of the things that we'll be doing is training a lot of our primary care physicians to detect things like depression, anxiety. In a lot of instances, when people come to the health center, we don't ask these questions. And they might be persons who are depressed, but because we didn't ask the right questions, we would never be able to make that diagnosis. And then we have seen a correlation between people who are depressed and who sometimes go and commit suicide. So we need to make this connection earlier and then offer treatment. And once we are able to do that, we'll change the dynamics of suicide and other mental health issues. So I think it's the bill provides that legal framework, but there are lots of work and restructuring what we're doing and how we're doing it to make sure that people can get the help they need.
Over the year, Guyana has been collaborating with international agencies to help strengthen the health sector. Those included Columbia University, Northwell Health, Mount Sinai Health System, to name a few. A few months ago, the ministry collaborated with McMaster's. In the year 2023, professors from McMaster's Canada and the United Kingdom will be rendering assistance with a comprehensive review of the maternal and child health system here in Guyana. Through McMaster's, doctors will be able to participate in fellowship programs in Canada.
We have had a professor who heads McMaster's obstetrics and gynecology program. They came to Guyana as part of an agreement that we have with McMaster's. And one of the things that we would also be doing next year is to review all of our systems in terms of what can be done to prevent these deaths. And so next year we have a team of professors from McMaster's in Canada. We have a team from the UK who will be coming to Guyana to help us do a comprehensive review to see whether or not we're missing anything. And they would also be supplementing with some teaching and strengthening and looking at how we can strengthen our systems. The ultimate goal of all of this is to prevent maternal deaths. In addition to that work that we'll be doing with McMaster's, McMaster's has opened up to us for us to send doctors to do fellowship training in Canada. And so starting next year, we'll have one of the doctors going up to McMaster's to do a 3-year fellowship. And again, when they come back, to bring that culture and to help to improve standards here.
Yes, ma'am. This is Johnson vaccine.
Yeah, see that? I just gave me booster shot. Once you get your first 2 doses of vaccine, you should take your booster shot. Nothing wrong with getting extra protection, you know. You see now, as a bad woman, because I could roll up my sleeve and I could say, hey, I chilling with the big boys because I fully vaccination, right? So I encourage all of you radical, I encourage all of you forgot and vaccination of yourself and get your booster shot, right? Now stay home and feel that you're fully protected just and I stop lying about the place, oh my mama. Corona share out and I just a lime about the place and I ain't even vaccinated.
Do boosters use the same ingredients as existing vaccines?
Yes. COVID-19 boosters are the same ingredients, formulation, as the current COVID-19 vaccines. However, in the case of a Moderna COVID-19 vaccine booster, the dose is half of the amount of the vaccine people get for their primary series.
A message from the Ministry of Health and the CDC.
As Guyana continues to establish more laws, an updated public health legislation is expected to be drafted within the second quarter of 2023. Preliminary works on the draft are currently being understudied by experts from PAHO and various organizations.
The one that we've already started a lot of work on is updating the public health legislation. In Guyana, we have a public health ordinance, so that's a pretty old piece of legislation. And it does not take care adequately of what is considered to be public health now. We have started during this year to draft a new public health legislation. That's going to be a very big piece of legislation. Already, I think we're looking at about 9 or 10 sections, huge sections, in this particular piece of legislation. We have had some experts from PAHO who came down, did some preliminary work. We have various working groups that are looking at each of the sections. And so by, I would say, first quarter, second quarter next year, we should have a working draft. And once we clean that up, we'll be able, by late in the year, probably to take that to Parliament. But it's a very, very comprehensive piece of legislation. A lot of people have been working on this, and it's taking a lot of time because of the amount of agencies that it would affect and we would have to work with.
Guyana continues to collaborate with Mount Sinai. As such, one of the projects in which the duo is working on is the development of an electronic health record. This initiative is expected to have its first legislative draft of concept to be considered law by the first or second quarter of the new year.
This one we have been collaborating very closely with Mount Sinai. Right now we are reviewing a draft in terms of the concepts that we should consider for the law. We have also examined about, I think, 15 or 20 countries, their laws relating to electronic health records. And so by, I would say, first quarter, second quarter next year, we should have a good draft of that legislation, and again we will walk it through spaces. This one is totally new to Guyana. We have to look at things like privacy, confidentiality, the types of operating systems that we will get, because what we envisage is that each patient would have maybe like a smart card. So when you come to the health center, you can present, or a hospital, you can present that. You put that into the computer, your records will come up. And maybe it will have different levels of who can see what. But we have to protect people's information. And that's why we're looking at different models to see which one would be best suited for Guyana. So, these are new things, they're groundbreaking things, and it will take a lot of time for us to put them together. But we need to put this together because we are going to introduce an electronic health record system, and we want to make sure that people's information is going to be protected.
Additionally, Guyana will be benefiting from an oncology and cardiovascular center from Mount Sinai.
Part of the work that we are doing with Mount Sinai is to develop an oncology center and a cardiovascular center. So the background work on that is ongoing. Next year, we'll probably have some clearer details on how we submit this.
As Guyana continues to collaborate with various international companies, the Maternal and Child Health Hospital is currently being built, and it is expected to be a level 5 hospital with European standards.
We have been looking at the Maternal and Child Health Hospital. So that contract has been awarded to VAMED. VAMED have taken over the site. They have started working. So very soon you will start seeing structures going up there. And again, when that hospital is completed, that's going to be built to European standard. So that's going to be a level 5 hospital, and we have various departments there. So 150 beds for children, 100 beds for mothers that would have complications. And we have several types of operating theaters there, including a cardiac suite. So we'll be able to do pediatric cardiac surgery in that hospital. That hospital will have our MRI located there as well. So that will be one of the first MRIs in the public sector. So you'll have a lot of updated equipment and different departments and subspecialty in pediatrics that would be in that hospital. So initially we will cater for the needs of our population, but I can see this hospital very clearly providing services for the rest of the region.
Apart from all those great achievements, Guyana has been credited for its management of the COVID-19 pandemic and also its high vaccination rate. To date, we have administered 494,291 first doses, 381,181 second doses, and 76,930 booster doses. While those numbers are significant, the Ministry of Health continues to appeal to the general public to get boosted. Wear a face mask to protect yourself and family from the deadly COVID-19 disease. With that, we want to wish you a happy, safe, and prosperous 2023.